Ketamine is very, very safe. There's a lot of misconceptions about the medicine.
Talk to me all the conditions that are indicated for someone coming to do ketamine.
So depression, anxiety, trauma, PTSD. It's really interesting how ketamine in the rooms, people like have these aha moments. They come out of the room, they're like, oh, I get it.
You're tuned in to the Dr. Kinney Show, and I'm your host, Dr. Erin Kinney, a naturopathic doctor and speaker dedicated to unraveling the mysteries of your body and guiding you back into balance. Let's get started. Hey everyone, welcome back to another episode of the Dr. Kinney Show. This week, I'm really pleased to have joining me Brad Masters, who is the CMO and Director of Patient Experiences at the Mood Center, which is a ketamine clinic in Annapolis, my hometown and where my clinic is. So I'm really excited to have them here and to share, for Brad to be on the show, to share everything that this clinic can offer and how this medicine is kind of changing the landscape of healthcare. So Brad, thank you so much for being here. I'm excited to hear your story and talk a little bit more about what you guys do.
Yeah, thanks for having me, Erin. I appreciate it.
Sure. So can you start by sharing with myself and listeners your story? Like, how did you end up here?
Yeah. So, and I've been in behavioral healthcare since 2011. So I actually got my start in this industry doing substance use disorder treatment. We launched a substance use disorder treatment center called Serenity Acres Treatment Center. Very passionate about that. It was I loved working in the field of mental health and specifically substance use disorder. And then from there, I went on to I was what was known as regional CEO for a company called Discovery Behavioral Health. So I oversaw their substance use facilities and mental health residentials and outpatients in this region. And right around that time, probably 2017, 2018, I started hearing about ketamine and ketamine for mental health. And I'll be the first to admit, coming from a substance use background, and I heard ketamine for mental health, and I'm like, wait, huh? We're using what? For what? But I was very curious, and I'm curious by nature. And I started meeting some people who were using it, and who were doing it, and kind of once you dive into the research, it's pretty straightforward how well it works, which is amazing because, in mental health, the medications we use typically, since Prozac came out in the 80s, roughly about a 30% of efficacy rate. So, ketamine, it's much higher than that. And it works quick too, for those that it works for. So anyway, I started hearing about that and started diving into it, started doing some research, and then, was approached by somebody else who was hearing about it in this area, and they're like, "Hey, we want to bring this to this area," and the Mood Center was born.
So cool. Thank you for sharing. I think kind of like you, when I first heard about ketamine, and I think any of us, when we first heard about, we're using MDMA or we're using those things, but now I think it's really cool to see how these, different types of, it's like more out of the box, right? Thinking about like how, and you gave me the best explanation of a psychedelic or a ketamine like thing. Can you do the ski slope explanation for us? I can't quite do it, but that made so much sense to me. This is why this stuff works. So explain to us how this therapy can like retrain your brain.
Totally. Yeah. So it's really cool. Ketamine is paving the way for a lot of other things, and really kind of how we think about some of these substances, or how we traditionally thought about it. Coming from a substance use background, I really do believe that part of the problem we have specifically in this country with substances is our relationship to substances, and as a whole, as a society, our relationship to substances. And when we start using things like ketamine and what it's paving the way for in a different way, we start to think about it differently. We start to respect it a little bit more and understand what it can actually do, and that's pretty powerful. So ketamine for mental health, and it actually, it's really interesting. It works really well for chronic pain too. And it's some of the same mechanisms actually help it work, very similarly. So, there's really four major ways in why it works. So the first one is, upon infusion. So for ketamine, there's either IV or IM is what we do here. So intravenously or intramuscular injection. And upon infusion, the first thing it does is it goes in and it blocks something called the NMDA receptor. And when that receptor gets blocked, it affects something called glutamate, which in turn affects something called neuroplasticity. So neuroplasticity is our brain's ability to adapt. So there's a doctor that used the analogy that I love. And he says, imagine you've been skiing down a ski slope for 26 years. Eventually you develop all these ruts in the snow, and you can't help but ski down the same rut over and over and over again. These are like the patterns we build in our life. Ketamine is like a fresh blanket of snow that comes in and fills the ruts. And so now you have the ability to build new ones. And I love that analogy, and we tell that to every single patient, because not only is it a great description on neuroplasticity and how that can help, in our lives, but it also describes the importance of what we're doing here is priming your brain for change. And it's just as important what you're doing outside of here, building those new healthy patterns and, and really focusing in on that. What's really cool about that is the NMDA receptor sits on something called an inhibitory neuron. So a lot of times when people are dealing with depression, anxiety, trauma, PTSD, you can feel stuck. It's almost like if you had your foot on the gas and the brake at the same time, right? You can't move. It's just you're stuck. So a lot of our patients describe it as blocks. Like I just got these blocks and I can't move forward. So when that inhibitory neuron gets blocked, it's almost like you take your foot off the brake. So now you can move forward. And we hear this all the time here. We hear the blocks are gone. The things that were holding me back are gone, right? So there's this really cool combination of not only is your brain primed for change, but at the same time, you've got the motivation and the drive is coming back, and you can actually do some of those things, which is very powerful when it comes to depression. You've also got a chemical called BDNF that gets released, brain-derived nootropic factor. So this works with neuroplasticity as well. But what's really cool about BDNF is it actually has the ability to heal cells and neurons that have been damaged due to chronic stress, depression, anxiety, trauma. It also affects something called the default mode network of the brain. So this is pretty interesting. It's hypothesized that this is where the ego lies. It's one of the reasons ketamine works so well for suicidal ideation. So a lot of times when you're dealing with chronic depression, the default mode network becomes overactive. It's only supposed to be active when we're not task-oriented. But the result may be you're constantly internalizing everything external to a very unhealthy level, or negative self-talk is really ramped up, right? You just can't shut it off. Things that can naturally help with quiet that portion of the brain down is like a solid meditation practice, being in nature a lot, but they take time to develop. Ketamine shuts that portion of the brain down immediately. So upon infusion, during infusion, there's this immediate relief from these thoughts that have been nagging us this whole time. That's important for a couple of reasons. One, when you're dealing with something like suicidal ideation, that's a very impactful, because there is no escape from those thoughts a lot of those times. And even just a glimmer of hope that's not always going to be there. It can be very powerful. But two, it's not uncommon, like I'll walk into a room after an infusion. I'm like, hey, how was that? And the person's like, oh my gosh, it's wild. It's like on the outside of my life looking in for the very first time. And so what's important about that is perception, right? So like talk therapy, and this pairs really well with talk therapy. It's awesome. These go together really well. Lots of strides can happen. But you work for these aha moments. I call them aha moments in talk therapy. So like you might intellectually know something, but there's a difference between knowing something and being able to apply it in your life. And it's really interesting how ketamine in the rooms, people like have these aha moments. They come out of the room, they're like, oh, I get it. Wow. Okay. I see it. It's like you're able to step outside yourself for a second and see it. Like, and you just kind of, it gets ingrained in your.
It's like you're able to see your life how someone else sees it, right?
Yeah.
Almost like how someone else sees you. Because I think I love what you said about, turning off that negative self-talk, which is so common for so many of us, right? I don't know why that is. You wouldn't think that would be very evolutionarily beneficial, right? To be like beating up on ourselves. But a lot of us do it. And particularly individuals with severe depression, anxiety, PTSD, they have a higher negative self-talk. But usually like their friends and family are like, wait, why would you say that about yourself? You have all these gifts. But I think any of these, it's like you're able to step outside and be like, oh, wow, look, I am a really amazing person. Look at that. Like,
absolutely.
Which is so important for healing.
Huge. And it's quick.
Yeah.
That's the beautiful thing about it. It's not, traditional talk therapy and medication, they take time, which is great. We need it. You know what I mean? And like I said, it pairs really well with it. There's a therapist that works with ketamine all the time that uses another analogy. I'm big on analogy. She says, if if traditional talk therapy is like going from DC to LA in a Prius, adding ketamine is like taking a jet plane. So it just gets you there.
Yeah.
It is just, it's just see it.
Yeah.
And it's pretty wild to see.
Well, I think if you're like, if you've regularly been in talk therapy, and I think probably a lot of people listening to this have probably experienced talk therapy in your life, just like you said, it can take a while, and you might have blocks or stories you've told yourself that, oh, I can't make that change because of X, Y, Z. And like you said, it might take 3 years for you to change that story, but ketamine will allow you to change that story. So then the thing you're working through therapy, it's like you'll sail through it, and then you can move on to the next layer. And so like things can happen a lot faster. But I would say, I think it is important to do talk therapy with the ketamine or any other psychedelic type treatment that you're doing, right? Because it's going to help you with the after part, right? It's going to help you not ski down the same track, right? Help you keep up with those new tracks that you're trying to develop.
Yeah, 100%. So we don't require it.
Yeah.
We give a lot of education. We believe big time, and everybody needs to understand kind of what's going on and what's happening so that they can be in the driver's seat of their treatment, right? We give a list of things that are recommended with treatment, talk therapy being one of them. We give every patient gets a journal to journal in the chair after the ketamine session, anything impactful that might have come up. I think it's, we're very big on meeting patients where they're at. And you could kind of mandate it, but I'll give you an example. Like we had a patient come in who had some pretty severe trauma and was dealing with a pretty severe depressive episode, and very resistant, actually in recovery from alcoholism, was really holding on by a thread, very resistant to talk therapy. When we suggested it, it's like, nope, I've done that. Doesn't work. I'm not doing it again. It's not going to happen. Don't try. Okay. It's totally fine. So, he came in, everything here is medically monitored. We've got our nurses and our doctors that are monitoring everything, making sure everything's safe. And 3 sessions in, there's a button in every room that you can push if we're not checking on you, need something. And he pushed the button, and we walked in, and he looked up and he said something pretty impactful to his trauma. And then he goes, can you help me find a therapist?
Oh, I love that.
And it was like this, I get chills thinking about it, but it was like this beautiful moment. And the thing is, had we put that boundary up in the beginning,
he wouldn't have come and done it. He would not have showed up. Yeah.
He wouldn't have gotten there. And so that's the reason, we don't force it. But ideally, yes, you're doing talk therapy, you're in talk therapy. I mean, there's all kinds of things you can incorporate. There's ketamine assisted psychotherapy that we can link you up with, and all kinds of things. So
yeah, which is really cool. And I know you and I have talked about this offline before. You can be on antidepressants while using this therapy, which I think is really cool, right? Right. You can continue to, if you're on that, you're like, oh, I'm scared to go off of that. You don't have to, correct?
Exactly. Ketamine is very, very safe. So it's been around for 50 plus years. I mean, all ambulances carry ketamine. They use ketamine to put adolescents under for surgeries. It's been around for a very, very long time. And so, yeah, that's one of the beautiful things about ketamine is you can use it with traditional antidepressants. Some of the things that they're studying that are going to be coming out, like MDMA and psilocybin, I'm not 100% sure you're going to be able to. You're going to have a washout period, most likely, which is really cool because all these things are going to be new tools in our toolbox. And now you've got something like ketamine that fits a certain population. And maybe that's even used as a bridge to get people to some of the therapies that are coming out for more specific things. So, yeah, really cool stuff.
It's a really exciting time to be, I think, connected anyway to the mental health and wellness space, because there are so many more tools. And as you mentioned at the beginning, like antidepressants only work 30% of the time. That's pretty bad statistics, right? Like that we can only help 30% of people with a pretty chronic and like high incidence of disease, right? Like a lot of people suffer from depression, anxiety, the things that ketamine can help. And a lot of people are put on antidepressants and don't feel much better. I mean, sometimes they feel a little bit better, but I treat a lot of depression, anxiety, and, usually there's other physical things that are going along with that. But a lot of them are like, yeah, I take an antidepressant. It maybe helps me a little bit, but it's not like life-changing for them, right? Whereas something like this could be life-changing.
Oh, 100%. I had a therapist refer a patient, chronic depression for years and years and years and years and years. And she, after 2 sessions, she had a follow-up session with him, and he called me, and I got scared at first because he's like, dude, she was mad, like in in our therapy session. And I'm like, she was mad. Why was she mad? And he said she couldn't believe that she had spent her whole life feeling the way she had felt and was starting to feel like what normal people feel like, and was mad of all the missed time.
Oh, wow.
Yeah. I mean, powerful stuff. Like, I get chills thinking about it. And that's not uncommon. Like,
Yeah.
you hear that stuff. But yeah, I mean, traditional medication, I mean, they have their place and they work for people.
Oh, yeah.
They work for some. But the issue is, and you would see this in residential treatment. It's like, it's 30% in the beginning. You track that out a year, it drops to 12%. So if you're in the 30% that it works for, after a year, there's a good chance, more than 50% chance it's not working anymore. And you have to either up the dose or you're switching to something else. And you see this a lot. You see people that are on, a lot of different medications over time. So
maybe you could like walk listeners through like what does it look like from start to finish when you go and get a ketamine treatment?
Yeah. So you would come in. So the first step would be coming in and get an assessment by one of our medical professionals. So they'll walk you through everything. You can meet with them to determine eligibility. So there's two routes to go. There's ketamine, IV and IM, which is the full molecule. And then there's Spravato, which is S-ketamine, which is a derivative of ketamine. So there's the R and the S. S-ketamine is the S side, and that's a nasal spray. So for S-ketamine, there's a little bit of a longer authorization process. It's a 2-hour monitoring period. You're in clinic 2 hours. If you were approved, you'd come in, it'd be 2 times a week for a month. And then after that, most people drop down to once a week, and that's the maintenance for it. You're in clinic 2 hours. For ketamine, it is, you're coming in 6 sessions in the course of 2 to 3 weeks. And it's an 1.5 hour monitoring. So you're in the room 1.5 hours. You get the journal for afterwards. There is, we call them boosters after that. So like once a month, you plan to come back once a month. And then after a while, based on symptoms, and we'll work with your clinical team, we can trail that back to like once a quarter. And then eventually, once you've kind of built those new patterns, that's the beautiful thing. There's really no need to come back. Which is really cool. So the importance of the 6 sessions. So, when we're talking about how it works, so that glutamate response and the BDNF response, so those surge, those responses happen like 1 to 3 days post infusion. So what you're looking to do in the initial phase is kind of keep that elevated. And so the latest research shows that, one session, typically you're getting 1 to 3 days of relief. When you stack the 6 sessions, it's 1 to 3 months of relief. And then when you're doing the boosters, you're kind of building.
Got it.
Building on that.
Yeah.
It happens it's interesting, like different people, it happens different places. There are some people that come in one session. It's like, oh my gosh, I feel so much different. Some people it's 3 sessions in, 4 sessions in, I've had some people who are into their boosters. 55 plus community, it takes a little bit longer to work. I was recently in Oregon shadowing another organization. They were able to confirm the same thing. But very, very effective.
Yeah. Yeah. And then talk about the difference. You mentioned the IM and the IV. You can choose those. And I know you've explained this to me before, but tell listeners like what's the difference between those options?
Yeah. So I usually recommend everybody start off with the IV, and as long as we can find a vein and everything's good. And the reason is, if you were to think of the dissociative side effect, and by the way, the dissociation with ketamine is a side effect. It doesn't happen every single time. Now, I would say the vast majority of the time it does, but it doesn't happen every single time. And only if it doesn't mean the medicine's not working either. But if you were to think of the dissociative side effect as a journey, right? We call them journeys. With the IV, the medicine is delivered over about a 40 to 50 minute period, usually 40 to 45. So it's kind of a slow journey up, and then it's kind of steadies out, and then it's kind of like a slow kind of come back down. And that's the journey side of it. With the IM, the medicine's going in all at once in a shot. And so it's more of a kind of a peak, right? Now, different people like different ways. And so exploring that and trying it different ways is absolutely fine. Some people, they come in, they'll try the IV and they want to try the IM, and they're like, I want to stick with the IM. Other people, they'll try the IM. They're like, no, I prefer the IV. Some people like to kind of get in the chair. So all of the rooms, we thought a lot about setting. It's a very comfortable environment. We make sure that zero gravity chairs, people feel safe. They're in a safe environment. Some people like to come in and get comfortable and kind of get their mind right. We focus a lot on setting intentions when you're coming for a ketamine treatment. So we talk a lot about like core beliefs and kind of getting to those. So we have a patient who comes in for severe social anxiety. And when we were talking with him about kind of what's driving that, it was the core belief that I'm not enough. It was a lack of self-esteem. So he comes into his treatments with the mantra, I am enough. And coming in that mind frame really helps reinforce that. So some people like to get in the chair and kind of get in the mindset while the medicine's kicking in, and other people, they kind of like that experience. But that's the main difference. The dosage is the same. It's just a delivery method.
Yeah. Yeah. So cool. So talk to me a little bit about, obviously we've been talking throughout the episode about depression, anxiety. Talk to me all the conditions that are indicated for someone coming to do ketamine.
Yeah. So depression, anxiety, trauma, PTSD, even things like fibromyalgia, Lyme's disease.
Oh, yeah, you mentioned the chronic pain. Yeah.
Yeah. It treats chronic pain really well. And it's so interesting. Like we'll have people that come in for chronic pain and they start seeing mood benefits and
cool.
things changing in their life. Yeah. Or people come in with, for mood and, they have nagging chronic pain and all of a sudden it's gone.
Yeah.
Yeah. Those two are so closely intertwined a lot of times. But it's interesting. I'll give our chronic pain patients when they come in, we'll give them a journal. And I've had a couple look at me like, I don't need this. I'm here for pain. I'm like, take the journal.
You probably need it. You probably have some mood stuff in there too.
Yeah. Sure enough. I had one patient who was coming for chronic pain and it was like, actually she was one that kind of fought me on taking the journal, but, a few sessions in, she's like, this thing came up with my dad in this journal. And it was like really impactful. And the next time she came in for a session, she was like, I had the most liberating, boundary setting conversation I've ever had with my father in my entire life. It was so amazing. And she was so proud of herself.
Oh, that's great.
It was just, it was really cool to see.
Yeah. Well, I think, it's interesting, chronic pain, being in chronic pain is going to make anyone depressed. Right. And then, and you see, I always tell patients where they're like, oh, I feel like I'm depressed, but now my body hurts. I'm like, everyone's seen those commercials. Are you depressed? Do you have, and it's always like, do you have body aches, X, X, Y, Z? So oftentimes they do go hand in hand. And sometimes people think it's just the physical thing that's going on, but usually there's something else emotional or a pattern or something that, can be rewired. And those are often the people that have gone conventional med for pain relief. They've gone holistic med for pain relief and nothing's worked, right? That's why they're in chronic pain. They've tried all the things, but, kind of like use something like this. It's so cool that it can help them get relief. Absolutely.
Chronic stress.
Yeah.
That can wreak havoc on the body.
Yeah.
So it's cool how it doesn't discriminate from chronic pain or the patient comes in and it's treating them holistically.
Yeah.
Medicine's doing, which is really wild.
Yeah. It's really cool. So what else do you want to tell us?
I think I love that there's so much interest in this. And I love where we're headed as an industry. And I think, ketamine, it's interesting. There are some, even me, when I first heard ketamine was being used for the use of treatment-resistant depression, anxiety, trauma, PTSD, I was kind of like, there's a lot of misconceptions about the medicine. I would encourage, anybody who is questioning it or has thoughts about it or even initial bias about it or, do the research, call, ask, talk. It's, especially for people that are in mental health or, who are clinicians in the space or anything like that. I think it's really, really, really important that they educate themselves on the tools that are coming up. Cause, I would never say that there is, that this is right for everybody. I would never say there's anything that's right for every single person, but I can guarantee, that there will be people that you come across that this is right for. And if you don't take the time to understand it and know it, I mean, that's a shame.
Yeah. Yeah. So local listeners, you can find Brad at the Mood Center. Anything that you want to share? What they can go to the website. Where else can they find you guys?
So www.themoodcenter.com. We're located right here on West Street, 927 West Street, real close to downtown Annapolis.
Yeah, it's a great spot.
Give us a call. I'm happy to chat with anybody who has any questions, anything like that. I appreciate the curiosity.
Yeah, and the facility is beautiful. I've been. It's great. The rooms are, as you said, they're like, you feel very relaxed, very safe, and you guys have done a great job like curating the space. Next question for you is, if someone is listening and they're not local and they want to research ketamine in their own, like where they live, what would you offer to them? Like, where should they go? Where's a good place for them to find resources or to find a place that would be, a good clinic essentially?
Yeah. So the things I would say that you want to look for are, so like for us, like, our medical director's a DO on the medical side.
Mm-hmm.
And we also have mental health. We have a psychiatrist. We actually have 2 that we're affiliated with. We have psychiatric nurse practitioners and nurse practitioners. I think this is both a medical and a psych thing. I think that, having that expertise in-house is very, very, very important. I think, so there have been some places that are just popping up that are kind of like, they don't have the proper expertise. And I've had some patients come through who have been to some places and unfortunately, I think what ends up happening, there's not a lot of education. They don't really understand what the medicine's doing or how it's working. It's more just administered. And when you're not in the driver's seat of your care and you don't really have a good understanding of what's happening, how can you create lasting change in your life? You might build bad patterns, or you might build the same patterns without realizing it because you don't know.
Yeah. Yeah. So do your research on wherever you're looking, like do your research, and we'll see if we can find some other resources for you to put in the show notes.
Yeah, absolutely. I'll see if I can find something and you can put a link to it.
That's awesome. Well, thank you so much, Brad. This has been fantastic. And I love that you're willing to talk about this and to spread this awareness so that more people can have access to this really cool new mental health tool that we have available to us.
Yeah, anytime. Thanks so much for having me. I appreciate it.
Thanks, guys. And we'll see everyone next week. Thank you for tuning in today. If you enjoyed this conversation, be sure to connect with me on social media and leave a rating and/or a review. This helps grow the show so more people have access to this knowledge that leads to empowered healing. Love and light, and see you next week.